I can tell you that it is as clinical as any other medicine or surgical branch. That we make a lot of money, easy money. We have to study a lot. So we have to study every subject. If you want to take radiology as a career, questions have become more applied. Practical aspect would help the student to do gymming and do whatever the technology we have at present. Unless we have good communication and interpersonal skills, it would be difficult. Interventional radiology का जो पैकेज होता है वो करीब 4-5 लाख 6 लाख तक का जाता है, बड़े शहरों में जाना पड़ता है. The starting package is very good in radiology. Choose to have limited working hours. Life is also about taking care of your family, flexibility to work from anywhere in the world. Even if you are in a Mount Everest or you are in a beach house for his over-the-top acting, more dramatic. I think super speciality and subspeciality in radiology is the need of the hour. The machines are becoming more and more proficient in giving better information. This is not how the medicine works. As clinical as their branch. It's a clinical branch. When we get a request for an investigation, hardly any clinical information. We have to write clinically correlate.
Welcome back. Today we are diving into the most sought after branch of NEET PG. Yes, you heard it right, radiology. But why is it the dream branch of every topper? Can AI really replace radiologist? Is it just money and chill, or there's something more that meets the eye? And to decode all of this, today I have got with me a great teacher, a leader with unmatched clinical insight, and a distinguished radiologist, respected Dr. SONJJAY PANDE sir, Professor and Head, Department of Radiology, NSCB Medical College, Jabalpur. With decades of experience, he has trained generation of PGs. To every MBBS student, NEET PG warriors, and aspiring radiologists, this episode is your playbook. Dive in. Radiology is everyone's dream, but is it all chill and money, or just crazy competition with AI breathing down your neck? Respected Dr. SONJJAY Pandey sir breaks it all down for you. Let's go. Sir, as we know, radiology is always among top 3 branches toppers go for. But why does it continue to be a cream of all PG choices?
I think if you look at it, modern medicine is quite evidence-based. So the patients are going in for investigations in a big way. So there is a lot of demand for radiologists, and as a result, there's job security. There's a lot of initial payment is also very good, and to top it all, there is a lot of flexibility in the working pattern, and their emergencies are also very less. So I guess all these as a package makes it a very lucrative specialty.
So there's so much talk about AI currently, but can AI and automation really replace a radiologist?
I don't think so. Firstly, whatever the technology we have at present is not enough to do to replace the radiologist. Moreover, I think it's not about only picking up a problem from the image, but it is the correlation of the clinical data, the laboratory data, and talking to the patient, which is needed to come to a diagnosis. That is what AI cannot do. It can only pick up a problem. In the coming years also, I don't think so it can replace human effort, because ultimately it is mind over matter that is important. So I think AI can be a helpful tool, but cannot replace humans.
So what are your views on rising competition in radiology, especially in tier 1 and 2 cities?
See, it is bound to happen. It has happened with other specialties of medicine. Now it is the time for radiology to face this dilemma. You know, as the number of seats have increased in the recent past, and more students are taking up radiology as a career, so this will happen. To overcome all this, one has to be updated in what is happening in current literature, what are the recent trends one has to be aware of, the use of technology, and one might have to take up subspecialty or maybe super specialty as a career. I think ultimately the patient is going to benefit from all this.
So sir, what should an MBBS student who is aiming for NEET PG or INICT with radiology as a dream branch should focus on from day one?
See, looking at the current trend, radiology is one of the top branches of the, in the NEET exam. So one has to study really hard to get the top rank if you want to take radiology as a career. Moreover, one has to attend all the clinical rounds and the clinical postings, because what we have seen is the questions have become more applied, clinically relevant. So not only studying theory, but also the practical aspect would help the student get a good rank. So that would be my advice to the students trying to take up radiology. Even for a fresh postgraduate, the starting package is very good in radiology. If you compare that to, say, medicine or surgery, the pay that a fresh radiologist gets is quite handsome. The second point I think good about radiology is very flexible, and you can choose to have limited working hours. So that gives you time to pursue your hobbies, etc. Because life is also about taking care of your family and your well-being, which I mean essentially a good lifestyle. And thirdly, I think the flexibility to work from anywhere in the world, even if you are in a Mount Everest or you are in a beach or you are hiking, if you have a good internet connection, you can do your reporting of CT and MR from a laptop. I think these things make radiology a good career option.
So, sir, one advice for future radiologists who are currently grinding through their UG or PG journey: what should they really know beyond textbooks?
The radiologist looks from inside to outside. That means we have a cross section of the body and we find a pathology inside, and hence we need to correlate with what is happening outside. That means the symptoms. So the result of this is that we need to have very sound clinical knowledge, and an extension of this would be good interpersonal skills. At times we have to talk to the clinician also. So unless we have good communication and interpersonal skills, it would be difficult to correlate all this. Moreover, radiology is heavily based on technology, which is evolving and very fast. So one has to be very good also in IT and computers. Thirdly, I would say radiologist has to be a keen observer with a keen sense of space. That means he should be able to think in 3 dimensions also, as X-rays are just a 2-dimensional image. So we have to have a good 3-dimensional acumen also.
So, sir, what are some of the biggest misconceptions students should unlearn before stepping into radiology?
One of the most commonly encountered question that I come across every day is that it is a non-clinical branch. So I can tell you that it is as clinical as any other medicine or surgical branch. Every day we are looking at the cases, looking at the images, looking at the laboratory data, the clinical data, correlating and talking to the patients and to the referring physicians. So making it as clinical as any other branch. The second most common misconcept is that we make a lot of money, easy money. And I can assure you that it is not an easy money. We have to study a lot. Since we are dealing with every faculty of medicine, so we have to study every subject. Actually, a bit of everything we have to know. And it's a lifelong learning experience. So it's a lot of hard work is involved. But at the end of the day, it is very satisfying also. I think super speciality and subspecialty in radiology is the need of the hour. As more the machines are becoming more and more proficient in giving better information, and the expectations of the referring physician is also there, is increasing. So I think by specializing in a particular branch of radiology, we can give more input for the benefit of the patients. I think so. It is the need of the hour, and we have specialties like interventional radiology, neuroradiology, chest radiology, MSK. So I think now the young generation is taking up these subspecialties.
सर, जैसे कि हम जानते हैं कि सरकार की नई योजनाओं से दवाइयां सस्ती हो गई हैं और ऑपरेशन फ्री में हो रहे हैं, क्या रेडियोलॉजी के क्षेत्र में सरकार ने कोई योजना लागू की है और उसका किस हद तक फायदा जनता को मिला है?
सरकार की जो योजनाएं हैं गरीबों के लिए, जैसे आयुष्मान भारत योजना, उसके रहने से वो गरीब मरीज जो पहले ये कॉस्टली इन्वेस्टिगेशन सीटी एमआरआई के लाभ से वंचित रह जाते थे, आजकल उनको ये सुविधाएं मिल रही हैं, वो भी मुफ्त। और बड़े इलाज जैसे इंटरवेंशनल रेडियोलॉजी का जो पैकेज होता है वो करीब 4-5 लाख 6 लाख तक का जाता है, और इस जांच को करवाने से या तो वो करवा नहीं पाते थे या बड़े शहरों में जाना पड़ता था। तो इस योजना के चलते उनको छोटे शहरों में और जो स्टेट रन गवर्नमेंट कॉलेजेस हैं उनका इलाज संभव हो पा रहा है। तो सरकार की भी तारीफ करनी चाहिए।
Pure coffee while works.
Coffee, black coffee without sugar and milk.
If a radiologist would be a superhero, what would it be?
Doctor Strange.
One word advice to PG residents.
Work hard.
One word advice to MBBS.
Develop lateral thinking.
One medical show that made you think, no, it is not how it works.
Dr. House, for his over-the-top acting, more dramatic, and in real life that this is not how the medicine works.
One advice to clinicians that they understood about radiology.
I think misunderstood. One advice, one word is not advice, but it's as clinical as their branch.
एक बार फिर से पूछ लेना।
हाँ.
One advice to clinicians that they misunderstood about radiology.
Yeah, it's a clinical branch.
And what are your views about kindly correlate clinically?
My views, most of the time when we get a request for an investigation, there's hardly any clinical information or laboratory data provided. So we have to write clinically correlate. If the clinician is kind enough to give us some data, then we can correlate the findings with the radiological investigation, maybe give you a diagnosis or a differential diagnosis. For my age, above the 50, I would do gymming and do running also. And I think everyone should do it for a sedentary lifestyle.